Welcome to EAU podcast series, Exploring Urology, a Roadmap for Medical Students. In this 6th episode, A Day in the Life of a Urologist, we are joined by Professor Michiel Sedelaar and Professor Pearce. They share insights into the challenges and rewards of this dynamic career, showcasing the variety and impact of their daily work. Whether you're considering urology as a career or are simply curious, join us as we uncover why urology is an essential part of modern healthcare and an exciting career path.
Hello, my name's Pearce. I am a urologist based in Manchester in the UK, and I'm the current president of the British Association of Urological Surgeons.
And my name is Michiel Sedelaar. I'm a professor of urology in Nijmegen, the Netherlands, and my main subject is oncourology and, in that sense, prostate cancer.
Michael, I think we've been asked to talk today about the day in the life of a urologist.
Sure.
I wonder whether it might help people or listeners to appreciate the differences in the healthcare systems that we work in.
Sure.
Perhaps if you give us a brief rundown of what your healthcare setting is like.
So I think the main difference between most countries in Europe and the Netherlands is that we don't have private practice. So we're all patients get the same insurance-based healthcare. So there's no differences in therapy or waiting list or anything else which could be seen as a disadvantage for people with less financial possibilities. In a good sense, we can call this a socialistic healthcare system, but I'm very proud of it, and it works. It works. It's a very expensive system, but it works.
That's very interesting. So, because of course, in the UK, we do have a state NHS, again, which we're all proud of, but there is also private practice. And in terms of urologists, probably around about 50 to 60% of urologists would also undertake private practice as well. So, but you're quite right, that effectively creates a two sort of system healthcare service. And that, of course, is separated purely from a financial perspective. And probably about 70% of patients availing themselves of private practice have insurance, and the other 30% simply pay as they need it. It's the same service available. The only difference is actually just time to get the service.
And in that sense, most of our medical specialists in the Netherlands are getting just normal wages, like that you work for a company. And part of it is still production-based. So we call that, the Dutch word for it is maatschap. And the doctors who work in such a maatschap, they get paid by the numbers of patients they see or treat. But for me, as an academic urologist, and for most medical specialists in the Netherlands, it doesn't really matter how many patients I see or how many surgeries I do, my wages stay the same. And that also takes away a little bit of in the Netherlands, we call it the perverse financial incentive to do surgeries to get a higher wage. I'm not saying that in other countries that's part of normal or daily life, but at least this is one of the philosophies in the Netherlands to get rid of those kind of financial hinders.
Yeah, and I guess listeners will be coming from all different countries, and they probably have hybrid versions of everything we've talked about. So, Michael, an average day for you, how would that pan out? Take us through that.
Shall I start with my cup of coffee in the morning?
Yeah, absolutely, absolutely.
So we start at 7:30. Let's say on a sort of round call. We discuss any emergencies we had the night before. We discuss some patients we put on the list for coming surgeries for the next couple of days or weeks. Then our outpatient starts at 8 o'clock. Our surgery starts at 8 o'clock. And then at 12 o'clock, we have a break. 1 o'clock, we start outpatients again. The surgery goes on until 4 o'clock. And usually at 4:30, we have a sort of afternoon round to wrap up the day. And we usually have a journal club or complication discussion afterwards. So our day starts at 7:30 and they end at, let's say, about 6 o'clock, 6:30.
And that's every weekday?
Yeah. No, well, on Friday we stop early, not 4:30, but 4 o'clock.
Okay,
So we got 30 minutes break there.
That's civilized, isn't it?
And of course, for my work as the chair of the department, not just clinical, but also research, also education, and of course, a lot of managerial stuff.
Yeah. I think there's no escaping managerial.
No, but sometimes I do like it, so that's no problem. And for you?
So slightly similar, but in the UK, we've sort of evolved now that when we do an on-call, we often do what we call a hot week. So the same consultant is on call throughout the day for the whole week. So that consultant would start at 8 o'clock. They'd do the ward round of all of the emergency admissions and all of the post-ops. Anybody who's an inpatient, they would see. They would then spend the day either covering gynecology theatre, doing an emergency list, or looking after patients on the ward. And they would repeat that every day for a week. So that means the rest of us who are not doing that can go straight to our clinic, which usually starts at 8:30 to 9 o'clock, or straight to theatre for surgery, which normally starts by consenting patients at around about 7 o'clock, with a view to starting with the theatre debrief at about 8:15, and then straight into surgery for the rest of the day. And again, aiming to finish around about 4:30.
And what's the usual? So in the Netherlands, it's usual to work 4 days out of 5. I work 5 days out of 5, but usually, let's say most of my colleagues work 4 days out of 5. And how's that in the UK?
Yeah, so normally we would work 5 days out of 5. But that does vary. Increasingly, people are going to 4 days. But of those 5 days, of course, the typical sort of pattern might be 4 days for the health service and 1 day on private practice.
There comes a little bit of difference.
Yeah. So a full-time contract for the NHS would be around about 40 hours. But on average in the UK, people would work between 44 and 46 hours for the NHS.
And the system you talked about for the on-call, we have a similar system, but we divide those days in two. So you got a day on-call urologist starting at 8, finishing at 4:30. And you got let's say, the evening or night on call, which starts at 4:30 and finishes at 8. So I'm now actually on a evening or night on call. And as you see, I'm just at home waiting things to happen. And
so that's similar for us, although we've got somebody during the day, the on call from 5 o'clock till 8 o'clock the next day, we share out all of the time. So you're right. So typically I would perhaps do one Monday evening every 2 weeks.
Yeah. So, and I think a lot of our listeners are somewhat younger than we are, changing generations, as we say. And in the Netherlands, we noticed that, let's say, the long working hours, which we've been trained for and which we've been accustomed to, maybe we don't like them, but at least we're accustomed to. New generation has a totally different view on how the healthcare system should work or how work should be. And of course, the balance between work and private life is maybe of more importance. I wouldn't say it wasn't of importance for me, but it's even more for new generation. So how would you think your system and our system should cope with those new days for urology?
Yeah, I think that's really difficult to know the correct answer, because work-life balance means different things to different people, of course. And therefore, it probably isn't for us to say what a work-life balance looks like, but perhaps for us to make sure that our colleagues are aware that it's okay to expect a work-life balance. And in many ways, they dictate that. But the outcome from it all, I think, is that they would probably be at work for either fewer hours or fewer days. And so our challenge is to figure out how we cover that, and how as a nation, or how each nation manages to cover that.
Seems like we need a lot of more doctors.
Yeah, I think that's right. And certainly in the UK, we're trying to do that. But there is a limit, of course, how many people each place can train, because we're already pretty full, because we need to make sure that our medical students and our less senior doctors and colleagues get appropriate experience across the board, don't we? We don't want that to be diluted.
So you need to have exposure to patients, exposure to pathologies, exposure to surgeries to let's say, to maintain a certain level, let's say, for the young doctors to be maybe our future doctors if we have our own problems. So
absolutely, definitely. So yes, it's a big challenge, but undoubtedly it's here to stay. And I think you're right. More and more people are demanding a level of work-life balance that perhaps when we were younger, we didn't feel empowered enough to demand, probably didn't think about it. Michael, can I ask you about your academic work? What percentage of your time is spent doing academia?
First of all, my clinical work is 2 full days of outpatients, 1 full day of surgery. So I got 2 days left to do my research, to do my education, to do my managerial work. I'm more into research than into education. Medical curriculum for urology is somewhat small. Maybe it's in all countries. We think it's too small. It's less exposure. So I've got let's say, full day every week for research, and I fill it with either discussing it with my research boards or research group leaders to see what our next steps in research are. I'm not so hands-on in research anymore because I don't have the time to be on the bench. I do some writing, but usually I do some correction of writing, of course.
And I think you talked about managerial responsibilities as head of department. Yep. That must take a significant amount of time.
Sure, but it's not every week. It's the same. You got some ad hoc, some more emergency stuff. You got some tactical, which is a couple of months in advance. You got some strategical, which, let's say, that's planning for the next year or years. It takes time because it also takes some mind time. At least you need to think about it, and you need to be uninterrupted from clinic or from research. I also have a business manager from the department, so the 2 of us are actually running the department. You can think about a department of roughly 100 to 140 people, all included. So the nurses, the doctors, the secretarial staff, the research staff. Yeah, let's say you're the boss of a little company.
It's interesting, isn't it? Because even in this very short time, I hope that the listeners will have appreciated that the massive variation of the work that gets done as a urologist. It's pure urology. It's also managerial. It's research. It's education. It's external agencies and organizations. I mean, it really is incredibly varied, isn't it?
Yeah, and it wasn't something we started on when we started our medical studies, of course. Let's say for me, I hope you're going to explain a little bit about yourself. But for me, it was just becoming a doctor. And then, of course, when you found your specialty, it was becoming a surgical specialist, and it was becoming a urologist. And then, of course, you develop into a research-minded urologist. And then you think, well, I can also be a leader of my department. And it slowly evolves. I'm wondering how it is for you, Ian.
Yeah, I think you're right. You hit on something very early on, that medical school and medical student exposure to urology is very poor. It's very, weak across the board, whichever medical school you're in. So when I left medical school, I don't think I had very much urology exposure, but I was fortunate enough when I was a younger doctor to work in urology. And I think the thing that really attracted me, apart from the variation of the work, were the people doing the work. These were a group of people who were entertaining, they were engaging. It was a very warm feeling in urology, and that's what really pulled me in. And I suspect, like all of us, we don't appreciate what paths our careers will take. We start off doing urology and essentially being purely clinical, and then we stray into education, into research, and into external roles. They build, don't they? Everything becomes a stepping stone, I think.
Yeah. And I think also it's an evolution of your own skills, right? You didn't know you were a leader, or you didn't know you liked research, at least not from the start. And then you either like it or you got some talent for it. Maybe it got recognized. That makes that you evolve in your work. I wouldn't say that it is still normal turning a urology at 35, 36 and being that the rest of your career. So everybody will have either in specialty, in depth more the stones, or in depth more the oncology, but also the whole world work around it. You're part of a healthcare system, and you want to be also involved in doing the right thing for that healthcare system. At least that's, from my point of view, a very important part of my work, is trying to make it better, not just for urology, but for the whole system in our hospital, or maybe beyond our hospital.
Yes, absolutely. And I think you bring a real important concept in there, and that is collaboration, because as urologists, I think we collaborate with quite a varied group of specialties. We integrate obviously with the transition service with our pediatric colleagues. We're often in colorectal colleagues' theatres, and obviously the close crossover with gynecology and urogynecology is quite significant. Yep. So we are fortunate, I think, in that we can get involved in such collaboration, and of course transplant surgery as well. So the variety of things that we can get involved in it is massive, and I think that in itself probably keeps us a bit fresher, because we all know that burnout is quite a significant problem, and I think one of the things that gives us longevity is the ability to have collaboration with new people and the ability to do different things as well.
I totally agree. And I think also on a collaborational level, you mentioned the fact that urologists are different, maybe as a species, than surgeons or orthopedic surgeons or internal medicine. It's not just the patient or the pathology you're interested in, but also the colleagues you work with. And that's also something I tell my interns when they are doing rounds in our hospital and trying to see what kind of specialty is something for them. Look at the people you work with and you pick the right group. And I always hear, and I know, of course, because we are urologists, but we are more like the social part of the surgical skills, and we are good in collaboration. I think that's the main thing most urologists are known for. So that's nice to hear.
I think that's absolutely right. From my perspective, I think it's the people that make the specialty. It is absolutely the biggest pull. I hope that our listeners, if they get a chance to experience some urology and some urologists, they will understand instantly what you and I are talking about.
Yeah, true. We're nice people.
Yes, even if we say so ourselves. Correct.
Who else would say that, right? So we need to be encouraging our own specialty. So
correct. Absolutely.
Is there something you want to share, let's say, from a day in a urologist, or maybe a mantra you work with for how to keep your work as interesting as possible for you and also find the balance between work and private life? Is there something you really say, well, that's something that's especially for Ian Pearce?
Well, I think from my perspective, Michael, it's very much about variety. I like to do different things, and urology offers me that. And I don't just mean different surgeries or different types of clinics, but I like to do different roles, whether that's managerial or educational. So I like the fact as a urologist that no day is the same as the previous days. So I really, really like the variety it brings. But I also like to think that I wouldn't ask other people to do something that I wouldn't do. So I think it's very much being in amongst the work and, hopefully breaking down those hierarchical barriers within the team to make sure that we can function effectively from all angles. And yourself?
Well, yesterday I heard somebody say, I like my work because it seems to be that my hobby became my work. And I think that's also something, right? If you enjoy the general part of your work, if you like your work, if you like your patients, if you like the pathology, if you like your colleagues, everything will be all right. Then the only thing you have to maintain is, of course, a healthy work-private balance. Look at the hours you work, be home at a sensible time, pay attention to your family, and also try to relax outside of your work.
No,
that's also something for the new generation.
You're absolutely right, and I very much hope that our listeners will take that to heart. That I think if you sit and work continuously, you won't achieve longevity in that. You will I think soon burn out, because it can be hard work, and you need to be all in to make it successful. So I think that would be a really lovely place for us to finish our discussion.
Love to talk to you, Ian, and it was great to hear something about the UK system.
Likewise, Michael, likewise. My pleasure.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.